You can see that the half of the patient's head is up. This means that when we perform an appellate angiogram, the patient's half of the patient's head is up. The first image is the MIP image. The only thing that can be seen in this image is the vessels, not the bones. The arteries will be white and the muscles will be gray. This is the BRT image. This is the BRT image with bone. The arteries with bone are shown. Now we will go to the main lecture. Peripheral angiography is a radiologic examination of the peripheral vasculature after the ingestion of contrast. This is the upper limb and lower limb. In these two areas, we use the word peripheral. The word peripheral is used only when performing upper limb or lower limb angiography. Peripheral means the outside. The word peripheral is the center. The word center means the center of the muscle and peripheral means the outside. The peripheral is used to call the hand. Introduction to upper limb angiogram. CT angiography of the upper limb is a non-invasive imaging test that uses X-rays and contrast medium to create a 3D image of the blood vessels in the upper extremity. The upper limb angiogram is used to see the blood vessels. It is a valuable diagnostic tool for evaluating the upper extremities of the vascular system. It is particularly useful for assessing blunt or penetrating trauma. The upper extremities of the vascular system are very useful for observing the blood vessels. It is especially useful for observing the veins that are so deep that they are very useful. Let's see the blood supply of the upper limb. The blood supply of the upper limb starts from the right subclavian artery on the right side and the left subclavian artery on the left side. The right subclavian artery is the right subclavian artery. The axillary artery goes from the axillary artery to various branches on the shoulder and some branches on the chest. The axillary artery is called the areole. The humerus is called the brachial artery. The axillary artery has 2 or 3 branches. The radial artery is called the radial artery. The other branch is called the anus artery. The 2 arteries are formed by a circle on the right side of the hand. The axial artery, the axillary artery, the brachial artery, the radial artery, the pulmonary artery, the pulmonary arc, and the vertebral arteries. And then common digital artery, proper digital artery, radial indices. These are called as one angle. Now we will see why the city upper limb endogram is done and what are the indications. This is called hand ischemia. If blood pressure in any part of the hand decreases, then the area of the hand or the corner of the hand becomes black. The corner of the hand becomes black, which means the blood pressure has decreased. Now let's see which artery has decreased blood pressure. Deep venous thrombosis or embolism. If the vein of the hand is removed, then deep venous thrombosis, clinical suspicion of vascular disease, hemodialysis, graft dysfunction. If the hemodialysis or any other disease is in the hand, then the cancer is applied to the hand. The cancer is grafted, but it does not work properly, then the vascular malformation, traumatic injury, evaluation of tumor. Pre- and postoperative evaluation and congenital anomalies and genetic syndrome. This is why the upper limb endogram is done. Contraindication as before. Impaired renal function, kidney failure, significant allergy to 4-contrast. Contraindication is a condition that is not treated in the first place. If the patient is sensitive to the 4-contrast, then the patient is allergic and pregnant. If the patient is pregnant and depending on the trimester. If the patient is in the 3rd trimester, then CT scan cannot be done. If the patient is in the 3rd trimester, then the CT scan cannot be done. Patient preparation is the same in all endograms. First, the patient needs to be in the hospital for 3 to 4 hours. Then we will know if the kidney function is good or not by serum creatine and eGFR. Then the patient's body will be removed with metal objects. The patient needs to be taken to the hospital for a hospital dress. And a consent signature from the patient's guardian. The patient needs to be treated with an 4 cannula. This is an important thing. We have done a cannula in the patient's hand in all endograms. But in this endogram, which is the upper limb endogram. In this case, we will cannula the kidney with the foot and contrast with the foot. The true aware artifact is the subclavian vein. If we put contrast in the hand, then it will be an artifact on the endogram. We have to cannula the kidney with the foot. What are the protocols? The protocols are the same in all endograms. First, we will take topogram. Then we will take a non-contrast scan of the entire hand. Then we will set the pre-monitoring. We will set the pre-monitoring slice. Then we will set the monitoring, i.e. ROI. Then we will do an angio scan. Then 2 scans will be done, arterial phase and venous phase. We will do the endogram in this protocol. Now, patient positioning. Patient positioning, head first supine. We will give this position and the hand will be on top. And the angle of the head will be a little straight and straight. And we will center the laser beam at the mid-chest. We will center the laser beam at the mid-chest. The scan will start from here and go to the other side. The scan will go to the head. And the end of the hand will be the end of the angle. The main scan will be cranial caudal. The first scan will be from the chest to the angle of the hand. It will be a photocranial scan. But the angiogram scan will be cranial caudal. It will start from the top and go to the bottom. The 4 cannula will be given by the foot. The angiogram will be shown by the hand. The angiogram will be shown by the foot. And that will be 18G cannula. And set 4 cannula on foot for bilateral CTN of upper extremity. The problem is that if we do an angiogram with one hand, and if we do an angiogram with 2 hands, then we can give a contrast with the palm. Then we can set the cannula with the palm. And if we do an angiogram with the palm, only with the single hand, then we can do the cannula with the palm. But if we do it with both hands, then if the doctor wants an upper limb, then we can do the cannula with the foot. The contrast is that we will use the bola stacking method. And we will set the RY. So here we will play the endograms we did earlier. Lower limb endogram, renal endogram, hepatic endogram. And in this endogram, we set the RY on the abdominal aorta. But in this endogram, we set the RY on the aortic arch. The aorta that rises from the foot. The aorta that rises and becomes A. We set the RY on the aortic arch. And the iodine ray contrast is 350 mg iodine per ml. 350 mg iodine per ml. That is the best. And we will give 100 ml contrast. And 40 ml normal saline. And we will set the flow rate 5 ml per second. So where do we set these? We will set them in this injector. We will set these parameters in the injector machine. So we will take a series of contrasts. We will take 100 ml in a series. And 40 ml in another series. And we will set the flow rate in the injector monitor. We will set the flow rate in the injector monitor. So we will set the flow rate. And we will automatically get the time. How much time it will take to close the contrast. So this is the topogram. When we do an upper limb endogram. So this is the topogram.